Hello, good afternoon. This is Justine Calderwood, holistic physical therapist at the Healing Spot Physical Therapy. And today I'm talking about the myofascial release approach as taught by John F. Barnes. So I'm going to give you a little bit of information about that, but I want to start with talking about just a few people that I've been able to help with this approach. So I'm just going to list a little bit about some of the things instead of going into some diagnoses, which I will in a little bit, but some of the specific functional things that people have been able to get back to doing and enjoying life because of myofascial release. So this is just a technique that I use, an approach that I use. It's huge in my practice because it's really shaped how I look at the body, how I treat patients, how I talk to them, and really identifying or recognizing, I should say, that physical pain is more than just coming from the physical, that there are some sometimes emotional and mental issues that are tied in with that, and I believe because of the training that I've done that you can't really separate all of that out. So I just want to tell you a few stories about some people that I've helped, just some real tidbit things. Just recently I had a lady that came in that hadn't been able to sleep more than 4 hours at a time, and that was a good night over the last couple years. I saw her last week and she emailed me and said, hey, I was able to sleep 6 hours without any kind of medication, and then she got up and slept another 2.5, and that's the most she had been able to sleep in the last 2 years. So helping people sleep better, because I know that helps us function, to be able to be present with our families and at work, and it just helps everything. Our immune system, helps our nervous system, everything. We have to get enough sleep. So that's one thing. I've helped a gentleman, father of 2, that had broken his back. He thought his only solution was going to be surgery, and he is now, did not have surgery, and is now running half marathons again. So that's been very rewarding to help him. Had a lady that was driving an hour one way to see me, that her main goal was, she was having some tennis elbow issues, and she thought her only solution was going to be surgery. It was hurting so bad she couldn't do the chores around her farm that she needed to, or her ranch, throwing hay bales and feeding her livestock and things like that. I think less than 6 visits I saw her, no surgery, she's doing fantastic. I've helped people with scoliosis. So I can remember one gentleman I treated that had been having some pain. Didn't really stop him from doing the things that he loved, like stand-up paddleboard and kayaking and mountain biking, but he just had a lot of residual pain. So he would do it, but he would pay a price. So getting him to the point where he can enjoy those activities without all the residual pain, that has been very rewarding to see that as well. Helping a mom get back to, just get to running and jumping and exercise class without having to wear a pad because of leaking. Again, somebody that wasn't giving it up, but just was able to help her not have to wear a pad, to feel more confident and more whole as a mother, as a woman. So those are just some examples. I mean, I've helped people with all kinds of things using this approach. And for me personally, I've been very helped with myofascial release. It's really why I'm very passionate. I've suffered from headaches since my early 20s, and I had tried a lot of different things, some crazy things too, including the dentist thought he had to shave my teeth off to realign my bite, which don't ever do that, people. It does not work, in my opinion. I had tried Botox injections into my forehead. I tried medication, even medication they thought I had anxiety, which it turns out I did, but it wasn't until I did counseling that that actually came up, and I did it in combination with the myofascial release. So that's just a bit of my story. So anyway, I want to talk a little bit about myofascial release. It's taught by John Barnes. He is the father of myofascial release. He has been teaching this for over 40 years. This is his book, Healing Ancient Wounds. If you want to read that, it's a great read. It talks the scientific part of it. It talks about his personal stories of his clients or his patients. He's a physical therapist. He is an amazing person. And so I'm going to talk a little bit more about what myofascial release is, if it's piqued your interest and you want to know a little bit more, possibly maybe be able to help you. This is an article you can find on his website at myofascialrelease.com. This is a picture of John, and the missing link in your treatment is what the article is called, and this is what I give a lot of my new patients and people that want a little bit more information. John talks about fascia being covering every single cell of our body. So your muscles, your nerves, your lymph nodes, your blood vessels, your bones, everything is covered by fascia. Okay, so he uses a whole body approach to look at where dysfunction is happening, where the body's being pulled out of midline, and where those strain patterns in the body are. And it's a very, very gentle technique. We just use our hands. It's not the same as massage because we're not sliding on the surface of the skin. So if you've had myofascial release before and it's hurt, or they've used lotion or cream and they're rubbing, that is not true myofascial release as taught by John Barnes. So because we have to sink down into that fascial tissue and we're listening to the tissues of the body, we're waiting for them to soften and respond and lengthen out, and really using the body's wisdom in order to bring healing and bring greater mobility back to the body. So the fascia can start to get bound down because of different things. Okay, so it can be because of long-term inflammation in your body. It can be because of poor posture. It can be because of surgeries. Okay, injuries, trauma, all kinds of things can cause restrictions in the fascial tissue. And it can put up to 2,000 pounds of pressure on pain-sensitive structures in your body. So when we do myofascial release, what we do is we start by looking at the posture, we feel into those tissues, and find out where is the body being pulled, and we just use our hands to very gently cradle those areas. We might do some cross hand releases where we sink down into the tissue and we're gently elongating out, waiting for the body to respond to that and soften, and following the body's lead. We might look like leg pulls. I'll have a patient lying down on their back and I'll do some very gentle leg pulls. I might do some spring tests to find out, is the right side or the left side more tight, and I'm holding that. It takes 90 to 120 seconds, so 90 seconds to about 2 minutes for the fascial tissue to start to respond. So when we do myofascial release, we don't get in a hurry, because we know it takes up to 2 minutes for the body to start to soften, to decide that it's okay to let go, and to release the restrictions that have occurred over time. And then we try to hold for 5 minutes or longer with each hold. The reason for that being is they've done research studies, they've done research on living fascia and how it responds, and at that 5-minute mark it releases interleukin 8, your body's own natural anti-inflammatory, and there's some interleukin 1b and 3, I believe, and those are vasodilators, anti-cancerous agents. So we're really trying to get the body to heal itself from the inside out. Okay, so we're working with the body's wisdom, and so some of the things that this helps with, I mentioned pain relief. If you're in pain and you want to get back to doing the things that you love to do, whether it be, kayaking, horseback riding, running, sitting on the floor with your kids, taking a walk, getting out in nature, crocheting, it doesn't matter. If you can't do it because you can't sit for that long, you can't stand, you can't walk, you can't go up and down hills, stairs bother you, those kinds of things, if you can't do them, that's going to affect your quality of life. And so myofascial release can really be, possibly be a solution for you. Sleeping better, I already mentioned that. First and foremost, we try to get out of that pain cycle. We're really working with the body to decrease pain, and then we're getting the body back to that function and trying to, that's where, after we get you out of pain, that's where I like to use exercise and things like that, strengthening, so that you can maintain that and restore your function. But first, we got to get you out of pain. Treating multiple areas. So if you are a person that has multiple areas, and maybe you've even tried physical therapy and it's not helping, my model of care is I'm pretty free to do what you need. I work for you as in my practice, versus in a lot of traditional therapy settings, if you have a doctor's order for your hip, and you're complaining of your shoulder, starts hurting, or your shoulder's hurting at the same time, or you have headaches or things like that. A lot of times those you might have hip pain in addition to shoulder pain, in addition to my neck hurts. You would have to get an order for all three of those things in a traditional healthcare setting, typically, or physical therapy setting. And it's hard to treat all those areas in 30 minutes or 45 minutes. So in my practice, I see people for 60 to 90 minutes at a time, and I treat the whole body. And the beauty about myofascial release is because everything is covered in this fascia. When we're addressing that, then we can treat the whole body. So even if I'm doing some leg pulls, I've had people tell me, oh my gosh, this sounds crazy, but my jaw is releasing, or wow, my neck is starting to let go, or my shoulders are sinking, that kind of stuff. And it's not surprising to me anymore, because I know these relationships and I've seen it time and again, and have felt it in my own body. So let's see, we do 3 things with myofascial release. There's 3 components of it. One is structural release, which is I've already described. So really sinking into those tissues and helping it lengthen out. And when people come into my practice, I use my hands to do that. And I give them a small ball so that they can do this at home. I have videos on how to use the small ball, so you can check my YouTube channel for those. But I really teach people where they can put this in, or, on their body, and how they can use it to get that relief in between sessions and progress forward. The other part of myofascial release, there's a triad. So structural release, we do something called unwinding. So that's allowing the body to self-correct. And so I try to teach my patients that as well. It's just allowing the body to move on its own kind of thing, letting the mind relax a little bit, let the body take over, because it knows where it needs to go at in space, so it can release those previous injuries and traumas and things like that. The other part of it is called rebounding, and that's just something that we try to get the fascial system to turn back into more of a fluid state. So it looks like a lot of like pushing the body away, waiting for it to come back, viewing it more like a cylinder of water, very fluid. So and that can be done, self-rebounding can be done by doing some like standing and jiggling and kind of swaying motions. Okay, so it kind of like stealth mode gets into those restrictions and allows the body to release them without having these bracing and holding patterns preventing it. So anyway, that is in a nutshell what myofascial release is. If you have any questions, please reach out to me. I'd be happy trying to give you some information here very quickly. But I've been studying with John Barnes for almost 6 years now, and it really is an approach that I use with every one of my patients. It is very, very gentle. I've treated 4-month-old. Actually, I've treated a newborn, even younger than that. I think the youngest I've treated was like 8 weeks, and I've treated the elderly. So anything along there's very few things that are contraindicated, or meaning that we can't treat with myofascial release, because it is that gentle. Okay. If you want more information, you can reach out and look for John's website, myofascialrelease.com. He also has a directory, so if you're not local to me and you're interested in this, please reach out. I'd be happy to help you find a therapist in your area or answer questions. But he does have a directory on his website where you can find people that he has trained in this approach. Okay, so thanks for watching, and I hope you have a great Monday.